Oh my goodness. I am so honored and excited to welcome two guests to the show today. One of them is a quadruple board certified um, pediatrician, internist, allergy immunologist, and lifestyle medicine physician and coach, Dr. Wada. And the second guest is our tiny, nearly newborn friend, Oliver, who is sleeping comfortably after he got his vaccines today. We are going to talk about Sjogren's disease, autoimmune disease, and the difficulty of being an invisible patient. Dr. Wada, thank you. And Oliver, thank you so much for being here.
Thank you so much for having us. I'm so excited to be able to continue to spread awareness, in particular about one of the most common autoimmune diseases that never gets talked about.
You know, I had an interview recently with another awesome physician named Dr. Marina Mamaliti, and we talked about boundaries. And I just want to start this by saying that you're here today with your son, and we had to reschedule. And if you hadn't said to me, yes, I can do it, but I need to bring my baby, we might not be here together. So it's just a beautiful and timely example of how asserting your boundaries and telling people what you need might just get you to a wonderful and beautiful place where you're getting what you need. And so I just want to point that out before we start. You are also known as the crunchy allergist, which I love. And you mentioned that in your coaching and your approach to your patients, you utilize a more natural and kind of holistic approach that is scientifically grounded, which I think is so huge and important, especially in the world of autoimmune disease, because as a sufferer of invisible illness, we'll talk about that. You can easily kind of get involved in or seek help from people who are not truly experts in their field like you are.
Yes, it's interesting. There are a lot of armchair immunologists, and I think they've all come out of the woodwork in the last 2 years. We're all pretty aware of that. But I think, we talk a lot in medicine and in our professional societies about this relatively newer described phenomenon, the Dunning-Kruger effect of sometimes you don't know what you don't know. And I was reflecting on this actually earlier today of my first month as an allergy immunology fellow. And that first month, I'm going through the basic immunology textbook, a chapter a week, doing great. Oh man, this is so fascinating, really excited. And then chapter 4 hit. And it was like the proverbial, hit the fan. And I wasn't in Kansas anymore. And, when all those cytokines and everything get involved, it gets pretty messy. And I think it's just a really good analogy and in just also realizing how nuanced and unique each of our situations is as an autoimmune patient too.
Yeah. So we're gonna let you know towards the end and in all the show notes and subtitles here where you can find Dr. Wada and how you can learn from her and work with her. But just want to point out first that it's really important that you get a really good, thorough medical workup, and certainly pursuing all of the lifestyle approaches and the different changes and non-medicinal things that you can do to approach autoimmune illness. You just want to make sure first and foremost that you are under the care of a specialist, of somebody who really knows and is experienced with treating autoimmune illnesses, because they are so complicated. So first, before we talk about your particular situation and how you kind of came to heal yourself and heal others, can you kind of shed light on autoimmune disease? Tell me what that means and what kind of conditions are included in that category.
Yeah. So autoimmune disease is one way that the immune system can misbehave. So we think about allergies. Allergies are the body overreacting to substances in our environment, pollen, pets, dust mites, so forth. Autoimmune disease is the body overreacting to ourselves. And so this can occur in a lot of different ways. The mechanisms are different for different conditions. And there are conditions that can affect virtually any part of the body from head to toe. And they generally are named for the organ system or organ systems that they affect. So for instance, rheumatoid arthritis affects the linings or the synovium of the joints. So creates a lot of pain, joint destruction, so on and so forth. In particular with Sjogren's, which is the condition I'm diagnosed with, it affects the exocrine glands. It's not the endocrine glands, which are the ones that secrete your hormones. It's the glands that secrete secretions. So your saliva, your tears, your snot, or mucus, and also for women, our genital urinary system as well.
So the body is essentially attacking itself or attacking something, some chemicals or
proteins
in the body.
Yeah. That
we create. So we create our own. Now, I want to ask you this, and this might be a controversial subject, but I have a lot of patients who take a holistic approach, and I have a lot of patients who don't want to take medicines and don't want to go down the road of traditional medicine, because the medications that we use to treat autoimmune disease, while they can be helpful and help improve quality of life, they have a lot of side effects. And so I end up having a conversation often about the incidence of autoimmune disease. How, people will ask me, well, where was autoimmune disease 100 years ago? Why is all of a sudden there is this tremendous increase in kids with peanut allergies or people with autoimmune conditions like rheumatoid arthritis, which is destructive to your joints, psoriatic arthritis, psoriasis, even some things like Hashimoto's thyroid disease and diabetes can be autoimmune. So did these conditions exist hundreds of years ago, or are we actually seeing an increased incidence, or are we just identifying and naming them now that we know about them?
So it's a little bit of both, but it is also significantly on the rise. And it's thought to be due to multiple different reasons. Certainly, lifestyle is a huge factor. If you consider how people were living even 200 years ago, it was a very different standard of living than how we live now.
Right.
We eat very different food, how it's packaged, processed, so forth. We are surrounded by different plastics. We put on lip gloss and, do different things with our skin and bathing habits. And in particular, what I find fascinating in some of the research is we're not exposed to particular infections that we once were, in particular, parasite infections. So I don't know about you, but I'm pretty excited that I don't have intestinal worms. But there is some thought that we don't have some of these different commensal or, slightly parasitic infections that we used to have that would keep our immune system in check.
Wow. What percentage or kind of how many of the incident cases, I should say, of autoimmune disease do you find are attributed to genetic causes?
So that's hard to say. We, at least from kind of my lifestyle medicine training, the adage is, and kind of the overarching studies would say that about 80% of our health is determined by our daily habits, and about 20% of our health is kind of, the roll of the dice with our genetics. Increasingly, we're finding evidence in a variety of different conditions that epigenetics, or kind of these changes that can occur in turning on and turning off genes, occur as a result of our lifestyle, but also maybe the result of our parents' lifestyle or our grandparents' lifestyle reflected in our health, which is really bonkers.
It's incredible, and it completely flips on its head the overriding theory that a lot of patients hold tight to, that your genes dictate your health. I think so many people think, well, my father had this, so I'm going to have that. Or, my kids are destined to deal with the same issues that I deal with because of genetics. And what you're saying is kind of what we've been really realizing recently, is that we have so much more control over our health than we really think. We really have more control than our genetics would suggest.
And I say that not in a sense of placing blame by any stretch,
Right.
but a sense of empowerment of that you do have some control and
Absolutely.
the reins.
Absolutely. Hi, Oliver. Good morning.
Oh.
He's a beauty. Oh,
He just wants that passy.
you let me know if you need to take a break and tend to him. Okay.
Maybe we'll have pause for a second.
Okay. Sure. No problem.
I may,
Okay. All right. Our little man is happy. Okay. So we were talking about how much control we actually do have over our health in, despite what our genetics might dictate. And that all comes in the form of lifestyle, how we live our lives, what we eat, what we put in our bodies, what kind of energy we expend, what we expose ourselves to. And as lifestyle medicine physicians, you and I both preach that on a daily basis, but we can never say it enough that you actually can change the course of your illness, the course of your lifestyle, of your life, the longevity of your life, and the quality of your life with lifestyle changes.
yes. And I think what was most telling for me was within days of making some dietary changes, pretty soon after I was diagnosed, pain I had dealt with for years prior vanished. Energy was better. I mean, it was one of those like, is this that placebo that everyone's talking about, or is this, real?
Yeah.
And for me, it was a lot of adding a lot more like fruits and vegetables, whole grains, nothing super off,
Yeah. So that's a great segue. Tell me your story. How, first of all, did you become an allergy immunology specialist because you had Sjogren's, or was that diagnosed after, coincidentally?
After.
Wow.
Yeah. So in hindsight, I probably had symptoms dating back to even college. I had an episode where my parotid gland, or that gland kind of on the side of your face that secretes some of your spit, was swollen. So I looked like I had mumps, and I had a saliva duct get clogged, which I went to a clinic that was a med student run clinic. So you can imagine I had the parade of medical students walking through like that senior year of college. But I was not diagnosed until spring of 2019, after I'd had my daughter. She was about 9 months old. Ironically, she was diagnosed with egg allergy like 2 weeks prior. So it was a wake up call in general for our family, and just kind of realizing we needed to kind of get out of survival mode and kind of reassess what we were doing and how we were living. But really what pushed me to advocate for getting labs drawn was my dental hygienist said that my mouth looked dry. And I said, well, I haven't been able to wear contacts for years because I have dry eye. And I did have something weird on my labs, a few years back. I probably should actually get that checked out. I'm pretty tired.
Yeah.
I just chalked up the fatigue, which in hindsight was pretty significant to being a tired mom, because I was a relatively new attending. I had a new baby. I had a toddler. But sure enough, I talk with a lot of fellow patients. Like, I almost feel lucky that my labs were, not normal, because it gave what I was experiencing a name, and it helped provide a path forward. So I ended up having the SSA positive, got the rest of the labs, and the rest was history.
Yeah. I mean, so you described symptoms. You had dry mouth, dry eyes, changes in your salivary glands. Are those the typical symptoms for Sjogren's syndrome, or are there others?
They are, and those are the ones you'll get, tested on your boards. But I think some other things in hindsight that came up that were little breadcrumbs along the trail. I had complained to my OB around the time my husband and I got married that I was dealing with painful intercourse that, typically you're not going to have maybe as much of an issue with, when you're in your mid-20s.
Yeah.
And then The other thing that I dealt with for many years were symptoms of IBS, which now we're still working out the exact mechanism, but thoughts that gut microbiome changes may precede or go along with development of autoimmune disease.
Yeah. Yeah, I know we talk a lot about gut health in general, but especially when it comes to autoimmune disease. I think the number is somewhere between 70 and 80% of our entire immune system lives in our intestinal flora. And the medications that we take, the diets that we follow, these are all the stress that we're under. These are all lifestyle factors that change the biology, the chemistry, and the physics of our GI tract, and can therefore predispose us to expressing things that we may be inclined to develop. You mentioned the labs, and I just want to touch on that for a second, because I've had a lot of patients who have ended up being diagnosed with an autoimmune condition, but their labs are entirely normal. And this could be a podcast episode in and of itself. Doctor, my labs are totally normal. Everybody says that there's nothing wrong with me, but I know there is something wrong. I'm having these symptoms. They are vague symptoms. I'm tired. I don't have a lot of energy. My appetite is different. I have skin changes, or, upset stomach frequently, despite not changing my diet. So what is a logical approach that a patient should take when their doctors say your labs are all normal? Because we hear a lot, go see a psychologist. Maybe you're just anxious, and we get tossed in the wastebasket diagnosis of this is, you need a checkup from the neck up. This is meaning this is all in your head. When in reality, these patients know they are suffering, even though the labs and the workup and the tests say that they are fine.
Yeah. And even thinking about the role of bias that plays in, we know weight bias, gender bias, certainly. But what I recommend for patients to do is, one, I think keeping a journal of some sort to organize your thoughts and your symptoms. See if you're noticing any particular patterns. When an immunologist, whether it's an allergist immunologist or a rheumatologist, talks with you, your symptoms and the characteristic of your symptoms, your history that we call it in medicine, is really important. So where is your pain? Is it pain or is it stiffness? How bad is it? How long is it lasting? Where do you know, does it travel anywhere? How long has it been going on? Those sorts of things are incredibly important. And for any of your medical professional guests listening, I think one of the things we learned first as medical students is treat the patient, not the number or not the lab. We all learn it in a slightly different way. But sadly, I think most of us forget. It's one of the first things we forget, especially when we're busy, we're crunched for time. Maybe we're burnt out and our bucket is empty. And so that would be my advice for us seeing these patients. The other thing that I think can be helpful is making sure you're getting a thorough workup. There are what we call seronegative autoimmune diseases. That means the blood work is negative, but there are maybe changes on X-ray or other studies that are just as important in the diagnosis. And so that's where having someone who is well-versed can be really helpful. And I think if you don't have a good fit, or you feel like you're not being listened to, that you don't necessarily have a good therapeutic relationship with your care team, it's worth thinking about a second opinion.
Yeah. I love the empowerment concept of patient self-advocacy. Certainly symptoms that we described, that vague constellation of symptoms, could certainly be something psychiatric, or it could be lifestyle. It could be nothing, but you need to make sure that you are advocating for yourself and getting the answers ultimately that you need, whether you have a condition or not. And so first and foremost, the connection with your primary care doctor is probably one of the most important relationships that you will have in your entire life, because I'm family medicine trained, and we know when you need to see a specialist. We do as much of a workup as we can to help identify what it is and what it's not. And when we need extra input from our colleagues who have fellowship training, we know that we can reach out to them and communicate and try to get more information about what it is and maybe what it's not, because sometimes knowing what it's not is just as important and just as helpful.
The other thing I'll tell patients too is our lives are like a movie. We're seeing you as a snapshot. And sometimes, especially if someone is very perceptive, very, in tune with their body, they may know something is up before it has reached that point where it meets what we call diagnostic criteria. And so I know that can be incredibly frustrating, and having a name for your constellation of symptoms really does provide a path forward and some prognosis and treatment and those sorts of things. But it's not, sometimes it's also a good thing not to be to that point yet.
Yeah. Yeah. So let's talk about, you were diagnosed with Sjogren's disease, and how did you move forward in attempting to heal yourself?
So this adds a little twist to the story. So after I kind of had that initial grieving period, like any good type A human, I wanted to do all the things. So I put myself on like a green smoothie regimen. I bought some really, what appeared to be amazing superfood supplements that were very heavily marketed to me through social media, and was working out really hard on my Peloton, trying to get in great shape. And I threw myself into a really terrible flare. I ended up with severe acute hepatitis, which means my liver was severely inflamed. My enzymes were through the roof. I was yellow and itchy. My urine was almost brown. That's not normal. You obviously know that very well, but, and so to make a long story short, I ended up with a liver biopsy that was suggestive of injury from that supplement, and maybe somehow influenced by the underlying Sjogren's, but thankfully there weren't signs of chronic inflammation related to autoimmune issues. And once I stopped using that and ended up kind of at that point cleaning up my diet and really embarking on this lifestyle journey in a more maybe a more mindful way, then I ended up doing much better. Thankfully, the liver inflammation resolved and kind of set me on this path of like, oh, okay, well, maybe there isn't a quick fix, and maybe I can't push myself as hard as I once had.
Yeah. And I think that's a great point when someone is diagnosed with, when their condition is given a name, when their symptoms are, now you have a disease or you have a condition, and you, like you said, you want to learn everything and start to do everything and make all of the changes all at once. That can be quite shocking to your system. And in the same sense, you're Googling autoimmune disease, you're Googling Sjogren's, and the algorithm out there has all of the ads popping up on your feed. And when you said earlier, you don't know what you don't know, when you're seeing these things that are being marketed to you, whether it's, advice from a non-expert or a supplement or a treatment, that's where it's really important to have that relationship with your doctor and run all of that stuff past your doctor to make sure that it's safe. I can't tell you how many times patients bring me supplements and ask me to read the ingredients. On the same hand, I can't tell you how many times patients will take stuff and not tell me because they're concerned that I'm going to judge them, and they're taking something that's either interacting with another medication that's causing their blood work to be abnormal, or giving them another symptom that, now requires an additional workup and testing. So it's really important that you know what you don't know, who to trust, and that you bring all of your health information and concerns to a trusted physician, to a trusted expert, please.
And I also just warn people that even though we sometimes think that something that's natural is safer, that's not always the case.
Great point.
And so even though, I bought this to put in my smoothie and thought, this will be fine and great, I should have. And now anytime I think about adding a supplement, I think about that with the same critical eye that I think about with my pharmaceutical meds, if not even more so, because yes, there are concerns, big pharma, et cetera.
Yeah.
The system's not perfect, but at least those medications that are FDA approved have gone through rigorous study. We have an idea of the likelihood or the percentage of people who have problems. And there's also an organized reporting system for people who have problems from those medications. We don't have any of that for supplements.
That's true. The supplement industry is an unregulated industry. And when people bring me that stuff about, oh, it's natural, it's this supplement that has 17 different quote unquote natural things. My standard response is, well, cocaine is natural. Anthrax is natural. These are all things that are arsenic. These are all things that, in the wrong hands or in the wrong set of circumstances can be fatal.
Yeah.
So it's great advice. Great advice. Tell me about some of the lifestyle changes that patients who have or are suspected to have an autoimmune condition can make, whether it's in addition to taking some of the medications, the disease modifying agents, or as a treatment alone. What are some of the things that they can do in terms of lifestyle to improve their symptoms and their quality of life?
So I think one of the big things I like to advocate for is what can you add to your diet? Okay. Rather than what can you take away. Okay. In general, I tend to, encourage people to add more plants to their diet in one way, shape, or form. So fruits, veggies, whole grains that you tolerate fine. If you are going to do a trial of gluten-free, that will come up pretty often with autoimmune disease. I do recommend that people talk with their docs about getting screened for celiac, because you want to do that before you take gluten out of your diet. It can affect the labs. The other thing that I think is crucial is learning strategies to manage stress. We know that stress is a huge element that can affect our immune system health. There were some of the original studies on immune system changes related to stress were actually done at Ohio State, where I work, by a husband and wife team, the Glaziers. They studied medical students and they looked to see how their white blood cells changed, over the course of the semester. And so we've known for a long time that stress can impact the immune system. We just don't always realize it, or, kind of realize there's science behind it. Yeah. And then similar, I think sleep is critical as well. So working on ways, whether it's blackout curtains, lowering the temperature, getting into a good nighttime bedtime routine and wake up routine is really helpful as well.
Yeah. And those three things that you mentioned, diet, sleep, and stress management, those are things that people think are kind of like a given that you should, just know how to do. But they're actually learned skills. They're actually things that we need to learn how to do. Just because you can fall asleep doesn't make you a good sleeper. And just because you're not a good sleeper doesn't mean that you can't become one. And so much of that has to do with how you approach it, your consistency, how you set things up. Same thing with stress management. And in a similar vein, stress management, sleep hygiene, and diet are all things that we know scientifically affect your health status. This is not just like, if I'm stressed out, I'm going to get, we know for sure that there are cascades of chemicals and hormones that lead to inflammation, which leads to all of the worst diseases. All of the most deadly and debilitating conditions that we have start with some component of inflammation. And we know that sleep, stress management, and diet can dramatically reduce your inflammation, the levels of those inflammatory cytokines, chemicals, and proteins. So this is scientifically based. I know you're crunchy and wholesome and you want to, give everybody all the good advice, but you, like you said, are also very scientifically grounded, and you want people to understand, like I do, that these recommendations are grounded in science. We have evidence to prove and research to prove that these things work, that these things, they're major factors in how healthy or unhealthy we are, and how long we live ultimately.
Yes. I'm a big fan of the idea of and. What can we do and, as opposed to the or?
Yeah. So you don't have to necessarily choose traditional medicine or holistic medicine. We call that integrative medicine, when we incorporate things that have been used for millions of years and have been decided that they're safe and maybe effective, and we use them in combination with some of the evidence-based, research-driven recommendations in terms of medical treatments, therapies, procedures, surgeries. I love your approach. I think it's awesome.
Well, and when you think about inflammation, sometimes you have 4-alarm fire going on. Like if you have a patient who's septic, arthritis flare, something along those lines, and you may need those big gun medications like a prednisone, taper or burst to help get that fire out before something that acts more like the fire containment system, like your, fire extinguisher or your sprinkler system, which might be lifestyle and maybe your turmeric supplements are really going to help.
Yeah. And that's a great point. Sometimes when we need to use medications, the lifestyle stuff can really support and augment how effective those medications are. The medications sometimes like prednisone will have side effects and can cause other things to flare up in your body. And so again, just going back to being ultra prepared in constant loyal and confident communication with your doctors, especially for somebody with an autoimmune disease, is probably the best advice we're going to give you, is just hand in hand with that expert by your side, somebody who, if you walk in the door, they know who you are, they know your history, they know what meds you're on. And, also possibly working with a coach, someone who is like yourself, board certified. There's a difference between a medical professional who is providing treatment or therapy for you and someone who is coaching you through. Coaching provides education, support, accountability, and not directed medical treatment. So maybe like you, it could be somebody who's one and the same, and maybe it could be 2 different people who are part of your treatment team that help you, attain comprehensive care for your condition.
Yeah. And what I have learned through coach training, which I think is so powerful, is just the role that our brain really does play in our body.
Yeah.
And that two-way communication. And so that's really what has kind of blown my mind and really, I think, helped with my own disease management and made me really excited to share that with others and bring that to others.
Yeah. One of the things that I kind of encourage my patients to do, which sounds really silly, but it can really make all the difference in terms of mindset, is when patients are diagnosed with a condition or a disease, let's say it's Sjogren's disease, instead of saying, words are important and they carry a lot of weight, instead of saying, I have Sjogren's disease, you can say, I suffer with, or I struggle with Sjogren's disease. So when you look at it as something that's outside of you, it kind of can come and go. It kind of, it's not something that makes you who you are. It is not your entire identity. It is something that you deal with and that you live with and that you can work with as it comes and goes through your life. But instead of saying, I have, diabetes, or I am a diabetic, or saying I have depression, or I am depressed, you can just say, I'm suffering with whatever that condition is. So that you know in your mind that it's something that you work with and you deal with. It's not who you are. Hey, Oliver, welcome back.
Hey. He's a little sad. Chilled out. One thing that I think is really, and we have other little ones too.
Hey, girls.
This is Josie. She's
the gang is all here. Let's see what you got, Josie.
She did some coloring, it looks like, today on black paper.
Ooh.
But what's fascinating about that too, Sjogren's is the circumstance, right? I have Sjogren and I can have all different thoughts about that circumstance.
Yeah.
And how I frame those thoughts are really going to inform my feelings, my actions, and my results with what happens with that. All right, girls, go see Daddy, please.
Hi.
Hey, girls.
Thank you.
Yeah, mindset is such a huge factor in how we approach our illnesses.
Please go with Daddy.
Okay.
Thank you.
Okay, bye.
Sorry about that.
It's the family channel. This is the family channel.
This is being a physician mom of 3.
I hear you. My son is just running up and down the stairs, slamming doors, and I'm texting him, hi, can you please stop slamming the doors, or come in and be on the show, whatever you want to do.
Yes. My office is our dining room. So.
Oh, I hear that too. Okay. So I'm going to let you go. But the last thing I want to ask you, if you have a minute, is just to kind of if you can just shed some light on and empower patients who may feel like they have an invisible illness or they are a difficult patient, with some words of advice as to how to approach that from your own experience as a patient or as a physician.
Yeah, I think one of the big things is to focus on really realizing that you are an expert in your own health. Even and I think that's really challenging, especially if you are in pain and you are suffering. But to know that you do know your body best, and it's really helpful to find someone who will partner with you in, doing a good, thorough medical workup, but also reassuring you if things do look okay for now, that, okay, we've really looked at all these different things, and we're going to keep that communication going, knowing that this is one point in time. But here are some things that maybe you've heard before, here are some lifestyle things that may actually still help, that may help turn the ship around if we are seeing that these are smoke signals, of inflammation starting, and that we can really try to help still improve your symptoms and your quality of life, using those techniques that really are based in science.
I think it's awesome advice. I love the work that you're doing. I think you're an absolute rock star of a mom and a doctor and a wife. You do it all. You make it look easy. Please, and I know that so many of my friends who are listening would like to learn more from you. So please share with us where we can find you, either on virtually or in real life.
Yeah, so I practice at Ohio State University in Columbus, Ohio. So if you are in Ohio, I can see you. Yes. I just sip the Kool-Aid when it comes to the team stuff. On social media, I am on Instagram and Facebook as at Crunchy Allergist, and on Twitter as Crunchy Allergy. I run a program called Redefining Success, which is a 30-day program that helps patients kick the fog and fatigue and find confidence and clarity through thought work. And I partner with a registered dietitian in teaching some of the, teach a person how to fish principles with nutrition. And my website is crunchyallergist.com.
Which is such a great website. I mean, there are videos where you can really get to know who you are and kind of see what you offer. Just one thing to clarify, is your course strictly for patients with Sjogren's or autoimmune disease, or is it for anyone?
So we are beta testing it with Sjogren's, but I am planning on expanding it to others once we have our proof of concept.
Wonderful. Wonderful. Well, thank you, Dr. Wada. Thank you, Oliver. Thank you, Josie, and the entire Wada family for being here. This is awesome. I think we could do 3 or 4 more episodes where you and I just kind of discuss all things allergy, immunology, and autoimmunity. I really appreciate you being here. Continue to do the work that you do because you are helping so many people.
Thank you. And I look forward to talking with you again soon.
Wonderful. Take care.
Take care. Bye-bye.
Bye.